Hi, welcome to lecture chapter 33 on bone densitometry. It is Dexa, and this picture is a routine Dexa scanner. Okay, bone densitometry is the measure of density in bone, and Dexa stands for dual energy X-ray absorptiometry. Try to say that 3 times fast. Absorptiometry. Okay, that's what Dexa stands for. It can be abbreviated Dexa with the E or without the E. Both are the same. Okay, bone densitometry is a term used to describe the art and science of measuring the bone mineral content. That's abbreviated BMC. That is used in a lot of the formulas for Dexa. And bone mineral density, BMD, of specific skeletal sites or the whole body. It's used to assess bone strength, diagnose diseases associated with low bone density, like osteoporosis. It's also used to monitor therapy. So if you've been diagnosed with osteoporosis and they have put you on medication, you will have follow-up DEXA scans to see how the therapy is doing. It's also used to predict future fracture risk. Okay, the current techniques with Dexa scanners either use ionizing radiation or ultrasound. There are ultrasound scanners out there. However, the most common is ionizing radiation, although it is low level. The most versatile and widely used, is the dual energy X-ray absorptiometry. So it uses 2 energy peaks. Okay, the advantages of using Dexa or having a Dexa scan are the low radiation dose. It is about 5 millisieverts to have a Dexa scan. A routine Dexa scan is 5 millisieverts. And if you remember from radiation protection, our background radiation, 3.1 plus, man-made, another 3, so it's actually less than what you get on an annual basis, just background, okay? It is readily available. Dexa scanners are everywhere. They are simple to use for qualified techs, and usually these are run by technicians. Short scan time, they used to be 5 to 7 minutes long, and now they're shorter than that. There are high resolution images, although we do not use Dexa images for diagnostic imaging, not ever. They are precise if the patient is positioned correctly. That is utmost importance in Dexa, is patient positioning. And lastly, to make sure that the calibration is current and correct. Okay, Dexa uses a subtraction technique. So it takes 2, not exactly pictures, but 2 readings of the X-ray going in at different kilovoltage. One is a higher beam, and however many photons hit the detector, that amount is subtracted from a lower beam. That and what this does is takes those 2 values and it subtracts the soft tissue, so that the number, the attenuation number left, is bone. Okay, bone that has attenuated those X-rays, those photons. Okay, it uses 2 different X-ray photon energies, uses the basic principle that the denser, more mineralized bone attenuates X-ray, more X-rays. The results are computed from software which calculates how many photons have struck the detector, and the images are generally generated for placement and region of interest or ROI placement only. They are not used for diagnostic. Okay, a little history of Dexa. In the 1920s, the first X-ray, conventional X-ray machines first demonstrated osteoporosis. So up until that point, it really wasn't studied or well known at all. So once they started seeing X-rays of osteoporotic bone and realized bone density was an issue for fractures, etc., it started being studied. In 1930s, the first article on bone mass quantification came out, where they were actually studying the different masses or bone mass loss. 1960s sparked radiogrammetry. This was from the astronauts going up into space, having a bone loss, and that was the first official study where they could study bone loss and have before and after quantitative data. In the 1970s, CT was being used for bone densitometry, where they go in and they have a CT scout, and then you set it up and you do the vertebral bodies. And that's the radiologist or the diagnosing physician would use those images and measurements to predict bone loss. In the 1970s and early 80s was the first dedicated bone densitometry unit. And this is a picture of what that CT, the quantitative computed tomography, looks like. So you have a scout image of the lumbar spine, 2 vertebral bodies, usually 4 and 5, are set up so that there's 2 slices in each vertebral body. And then once those images are taken, you can measure the density of the vertebral body. Okay, in 1987, the first commercial Dexa scanner was made. And in the late 1990s, development of smaller portable units for peripheral scans. And this one here measures the bone density of the calcaneus, and usually they sit in a water bath. And the water bath compensates for the lack of soft tissue, because believe it or not, in Dexa, soft tissue, that soft tissue component is important to have accurate readings. Okay, so how bone forms and how it loses its density over time is called bone remodeling. Okay, remodeling is just the process of old bone resorption and new bone formation. So in healthy people, the equivalent of a whole new skeleton is formed every 7 years of your body just absorbing old bone cells and making new bone cells. And stable bone mass requires equal resorption versus formation. So osteoclasts are the bone destroying cells, and the osteoblasts are the bone building cells. Okay, and this process is constantly going on in different parts of your skeleton all of the time. Okay. And like I said, the stable ones will equal the resorption and the formation. So they operate, the osteoclasts and the osteoblasts operate as a bone remodeling unit. So you're always increasing your bone mass from birth as you grow, and you reach a peak bone mass between 20 to 30 years of age. After that peak bone mass has been reached, you have a stable period in your middle age where you don't increase any more bone mass, but you don't decrease either. Your bone remodeling unit of your osteoclasts and your osteoblasts are evening each other out and keeping stable bone mass. It starts decreasing as you age. With women, usually it starts around age 50 due to an estrogen drop-off for perimenopause and menopause and then postmenopause. And in men, it starts dropping off at 65. Okay, there is a video that I put into Moodle about bone remodeling. I suggest you watch that. It is only, I think, 5 minutes long, and it's got some good information in there. Okay. Osteoporosis. So this is a disease characterized by low bone mass and structural deterioration of bone tissue. And as you can see in this picture on the right here, what happens with osteoporosis, this is a spinal vertebra. What happens is the vertical parts of this network of bone mineral formation, the vertical parts get thick. They get thicker. But the horizontal parts decrease. And so what happens is that vertebral body collapses on itself. Okay, so you see that a lot in older people that have had injuries to their spines. Those vertebral bodies no longer have the height that they're used to. Okay, an estimated 10 million people in the United States have osteoporosis. 80% are women. Okay, an estimated 48 million have low bone mass, which is just one step away from osteoporosis. Okay, the types of osteoporosis are primary and secondary. Primary has two different types in it. So primary type 1 is post-menopausal causes, okay? The bone resorption is exceeding the formation, and that's mainly due to lack of estrogen. Okay, type 2, primary type 2, is age-related. It can happen to men and women, and it's a decreased ability to build bone. So we talked about our geriatric patients' organ systems just starting to fail due to age. And this is part of that. It's age-related, and your body has a decreased ability to build bone. Okay, the secondary type of osteoporosis is skeletal disorders and results in an imbalance of the bone turnover. So there's too much resorption or too much formation, depending on what kind of skeletal disorder that has been diagnosed. Okay, risk factors generally are female gender. However, it's not exclusive. 1 in 2 women will be diagnosed with osteoporosis and have an osteoporotic fracture. Okay, 1 in 4 men will have an osteoporotic fracture. So it's not exclusive to just females. However, the risk factor is higher in the female gender. Okay, increased age, estrogen deficiency, Caucasian race, low body weight, so a low body mass index. Family history of osteoporosis or fracture, so there's a hereditary component. A history of a prior fracture as an adult, mainly probably because your bone does not heal as well as original bone when it's fractured, okay? And smoking, tobacco. Okay, bone health recommendations. The National Osteoporosis Foundation's bone health and prevention recommendations are as follows. You need calcium and you need vitamin D. Okay, so on page 450 of your text is a table, and I'd like you guys to know what the recommendation of calcium is for a normal 19 to 50-year-old individual. In addition to that, know how much vitamin D. And the reason for that is vitamin D and calcium go hand in hand. Okay, if you don't have enough vitamin D, your body can't absorb the calcium and use it. Okay, you also need to engage in regular weight bearing and resistance exercise. So whatever you can do to put weight on your bones helps your body make strong bone. Okay, avoid smoking and excessive alcohol. Okay, so we're going to get into the physical principles now of Dexa scanning, and this is 2 pictures here. These are fan beam scanners, okay? The original scanners used pencil beam, and what it was a little teeny pinhole collimator, and that x-ray beam went through that pinhole collimator in a little pencil beam, and it scanned back and forth the body horizontally. So say that you were measuring hip bone density, it would go back and forth horizontally over that region of interest. And as a result, the scan times were a bit long, 5 to 7 minutes or so. Okay. After that, they came up with the fan beam. And what this is a wide slit collimator so that the x-ray beam comes out in a fan. Okay, it reduced the scan time, so now they don't have to scan serpentine or back and forth across the region of interest. They just have to scan one direction, okay, right over the body part. Okay, and that reduced the scan time. So the mathematics of bone densitometry, there's 3 key statistics that are particularly important. The mean, the standard deviation, and the percent coefficient of variation. Okay, the mean is the average. It's the sum of the data values divided by the number of values. The standard deviation is a measure of variability. It measures the spread of the data values around their mean. The smaller spread is preferred in bone densitometry, and you'll understand what these statistics have to do with Dexa in just a few minutes. Okay, the percent CV allows the comparison of variability between different data sets, whether or not they have the same mean, and that's important in Dexa. So the smaller variability comparison, the better for bone densitometry. Okay, two important performance measures. Accuracy, it's the ability of the system to measure the true value of the object, and it's determined by the calibration of the scanner. So it has to be set and manufactured by this manufacturer, and the people using the scanner have to make sure that QA and QC is done correctly and precisely. Okay, the second thing is precision. It's the ability of the system to reproduce the same results in repeat measurements of the same object. So each Dexa lab should determine its precision error and calculate least significant change. But more importantly, precision, the ability of the system to reproduce the same results in repeat measurements, comes from the tech positioning the patient exactly the way that they did in the baseline scan. Okay, so a tech, to be able to be a Dexa tech, like I said, it's a technician versus a technologist. They go through radiation protection, they take patient care, they know how to take a history, basic computer skills, basic scanner quality control. Patient positioning, like I said, is imperative in Dexa, so they need to learn that. How to operate the machine is very important. There's 3 different manufacturers for Dexa, and machines do not talk to each other, so different software, you can't integrate those Dexa scan results. So the techs need to know how to operate the machine that they are using specifically, how to keep an electronic record, and how to do their documentation. Okay, test results in Dexa come in usually a report that looks similar to this. It'll have a picture of one of the body parts that they used for the Dexa scan. It's going to have a graph on there, and it's going to have some values. Okay, 2 scores are going to be important on there. One is the T-score. This is a number that shows the amount of bone you have compared with a young adult of the same gender with great peak bone mass. So this is you compared to someone who's in perfect health. A score of -1 or above is considered normal. Okay, a score between -1.1 and -2.4 is classified as osteopenia, or the low bone mass. This is one step towards osteoporosis, okay? And a score of -2.5 and below is defined as osteoporosis. The T-score is used to estimate the risk of developing a fracture. So it also will be used to determine if you should be on some kind of medication. Okay, on the medication front, I want you guys to know what type of medication is normal for someone with osteoporosis. And on page 448 in your textbook is common medications that people with osteoporosis have been prescribed. Okay, the most common ones, osteoporosis medications, are called biphosphonates, okay? And you might know these by their brand name: Fosamax, Boniva, Actonol, and Reclast, okay? Those are biphosphonates. And those are all prescribed and FDA approved for treating osteoporosis, okay? Men take them, postmenopausal women can take them. It prevents osteoporosis if you don't have it already. It treats osteoporosis if you do have it. It can prevent some of them, the Actonel and the Reclast, according to your text, can prevent osteoporosis that might be caused by taking steroids, like prednisone, okay? But all of those biphosphonates can treat osteoporosis that is caused by steroid meds, okay? Okay, moving on. The Z-score is this number reflects the amount of bone you have compared with other people in your age group of the same size and gender. So if this score is unusually high or low, it indicates a need for further testing, okay? Now it says small changes may normally be observed between scans due to differences in positioning and are usually not significant. However, since positioning is crucial to getting accurate results, Dexa technicians have been trained to, at the very beginning of the scan, if they see numbers or an image that is off even slightly, they know that those results will be skewed and they will stop the scan and reposition the patient. Okay, so the benefits of Dexa. Dexa bone densitometry is a simple, quick, and non-invasive procedure. No anesthesia is required. The amount of radiation used is extremely small. It says here less than 1/10 the dose of a standard chest x-ray and less than a day's exposure to natural radiation. We know that not to be true. Our natural background radiation dose is 3.1 millisieverts annually, okay? And we know, according to our textbook, that a normal Dexa scan is about 5 millisieverts. So you guys in your advanced knowledge of radiation protection know that this is still radiation. So you're only going to get a scan if the benefits outweigh the risks of the radiation, okay? Dexa bone density testing, currently the best standardized method that is available to diagnose osteoporosis, okay? It is also used as an accurate estimator for future fracture risk. Dexa can be used to make a decision whether treatment is required. It also is used to monitor the effectiveness of treatment that you are on. Okay, so you will have a baseline scan, they'll put you on a treatment like Fosamax, and then they will have you do serial scans afterwards to see if the treatment is being effective. Okay. And lastly, Dexa equipment is widely available, so it is convenient. Okay, other ways that you can measure bone density is through central or skeletal measurements, okay, total body composition, pediatric assessment, and peripheral skeletal measurements. And this is just a picture of another Dexa machine and Dexa test, okay. All right, here's some questions. There is only one primary type of osteoporosis, and it is caused by old age. True or false? So the answer to this is false. Remember that there are two types of osteoporosis. That's primary and secondary. And the primary has two types within itself, type 1 and type 2. Okay? Next question. All of the following are features of bone densitometry examinations except A, excess bone strength, B, evaluate and stage bone cancers, C, monitor therapy, and D, predict fracture risk. The answer, except B, evaluate and stage bone cancers. Dexa is not used for diagnostic purposes. Okay, which of the following are advantages of Dexa? 1, low radiation dose, 2, readily available, and 3, high resolution images. Okay. Your text does mention high-resolution images, but that is not the reason that you have a Dexa scan. You have it for the low radiation dose, and it's readily available. Those are advantages to Dexa, so it is 1 and 2 only. Even though the images are pretty good, they are by no means diagnostic quality, okay? And that is all we have for today. So good luck and study hard.